And welcome to UofL Today with Mark Hebert from 93.9 The Ville. This is the show that's about all the great stuff going on at the University of Louisville. We talk to all the great people at the University of Louisville. So stick around for the next 30 minutes or so. Maybe you'll learn something. You'll learn something about the people at UofL. On the show today, can acupuncture help kids deal with their health issues? Well, yes it can. And UofL's Lizzie Doll is doing it, and you'll hear from her. And is there a link between Zika virus and schizophrenia? We'll talk to a couple of UofL researchers about that and their research on that. But first, every summer and sometimes during the school year, UofL medical school students travel the globe on international learning trips. Bethany Hodge coordinates those trips for the Global Education Program in the School of Medicine. She's here along with two students, Tyler Ruch and Charles Shofner, who traveled over the summer. Welcome to all of you. Good to see you.
Thank you. Good morning.
You two made it back safely. Very good. Good to hear you. All right. Well, Bethany, let's start with you. What is the Global Education Program?
It has a lot of different parts to it. The main part that students get really excited about, I think, is the International Summer Service Learning Trips. We have about 40 students go every summer to various countries, mostly doing primary care pop-up clinics and getting a good exposure to clinical medicine earlier in their career, getting to see different parts of the world, getting to work with translators and work on skills having to do with using different languages when they're seeing patients. And overall, they seem to really enjoy it and learn a lot.
And where did the students go this summer?
This summer, we had students in Tanzania, Brazil, and Ecuador.
Okay. All right. Well, let's start with you two then. All right, Tyler, we'll start with you. Where did you go this summer, and what did you learn?
I had the esteemed pleasure to go to Tanzania. I can't say enough great things about my classmates that went with me, the physicians that we kind of learned from there, and just the culture in general. They're very stoic people. They are very private. For example, we had many an opportunity to do a pelvic exam and a rectal exam, and all of these people had so much privacy and just a respect for their own culture that was unrivaled that we see in the U.S. here. So being able to just kind of go there with classmates and see all of my classmates use what they've learned in the past year and a half is just been incredible. So,
had you ever been to Africa?
No, it was my first time. So definitely a dose of perspective for sure.
Okay, so what did you do? And is it Tanzania or Tanzania? It's the Tanzanian devil when I grew up.
However you want to pronounce it, I will answer. No. So we went, and basically throughout the course of 10 days, we saw a little over 1,000 patients, which was great. And it made us as a group think about sustainability issues there. Like, what do these people do when we're not there? Who are these people seeing for their medical care, and how are they going to get their care? And that was the hardest part for us, is that we wanted to do so much, but there were kind of constraints about it. And so it gave us that perspective and like a global learning where you kind of take for granted what we have here. Like, you can go to Walgreens and pick up ibuprofen, but these people rely on that for some of their back pain and stuff like that. So just really getting the chance to experience a different culture and work with your friends and classmates and your future colleagues was again, unrivaled.
And how many folks were with you?
15 of us total,
15.
including myself.
Bethany?
And I'd say, too, this is, we've been back to this site in Tanzania several times now, and we've started to build relationships not only with the non-governmental organization that we were working with there, but also local people and our translators that are coming back again. And we're seeing patients that are looking forward to coming and seeing us every year and getting to have a little bit of continuity. In the meantime, I field a lot of phone calls and text messages from that site to keep continuing care over the year, too.
All right. Well, I got some more questions about that. But Charles Shofner, let's turn to you now. Where'd you go this summer?
So I had the pleasure of going to the Napo province in Ecuador. It's in the heart of the Amazon rainforest. So over the course of 8 days, we set up 8 different sort of pop-up clinics that provided primary care. Basically, if you want to think of it, we would go into a school or a community center, use tarps to set up patient rooms, set up a pharmacy, a place to take vitals, and just provide basic medical care to communities that don't have the opportunity to access care like we do in the U.S.
And how many UofL medical students were with you?
So we had 17 UofL medical students with us.
Okay. And was this a small village, or were these real small villages, or cities, or what?
So there was a mixture. We started out in a larger city that we would go to various communities around the city. And then for the second half of the week, we went deeper into the rainforest, and it really became smaller villages.
When you say deeper into the rainforest, I mean, did you see giant anacondas or stuff
no
wrapped around your
anacondas.
neck or
We
anything?
did see a lot of tarantulas. that were just climbing around on trees, and it was definitely an adventure. I did take the opportunity to eat one of what is called a chontacuro, which is basically a worm that they grill. And I'm not going to lie, it sort of tasted like bacon.
They do.
So
it's true.
it was actually
It's
really
tastes
absolutely
like
tasty.
bacon.
It does. It's a weird experience.
Okay. All right. So it didn't taste like chicken, though, right?
It did not taste like
Because
chicken.
everything tastes like chicken.
Yeah,
All
no.
right. All right, we're talking with Charles Shofner and Tyler Ruch, who are medical school students at the University of Louisville, and also with Bethany Hodge, who coordinates the global education program at UofL. And they're talking about their experiences this summer. So, Bethany, when students come to you and they want to do one of these trips, is it because it's required of them to do one of these trips, or just because they want the experience?
This is purely elective, and actually students have to put in a lot of extra effort to complete pre-departure training, go to lectures, learn things online to prepare themselves for the trip. And they do that in addition to their regular medical school work. And then they have to raise their own money, both for their personal costs to be able to go on the trip and for the money that we need to buy supplies and medicines and other things that we actually give to patients while we're in country. Okay. It's a lot of extra effort.
So, Charles, while you were in country, in Ecuador, what did you learn?
Oh, great question. I feel like it was a great opportunity to learn so much. I think one of the biggest takeaways for me was that I'll continue to carry moving forward was a greater sense of cultural sensitivity. Here in the city of Louisville, we have such a strong population of immigrants and refugees and people from all over the world that I think taking this opportunity to travel to another country and seeing and interacting with cultures different from my own will give me a greater appreciation. At the School of Medicine, we're taught to treat the patient, not the disease, and I think this was one of the key opportunities to learn how to actually do that.
And Tyler, same question to you. What was the biggest learning, other than you talked about the sensitivity as well? What were the biggest takeaways for you?
Yeah, Mark, the first time that I thought about going to Tanzania, I was like, you know what? I really want to see the continental differences in disease itself. So what diseases we have here are completely different. Well, not completely, but somewhat different than what we saw in Africa. Like, we at least were able to diagnose 5 cases of TB, and that I've never seen TB before, or tuberculosis, and that was incredible to see. For example, I had a patient who came in, and she had dislocated her shoulder, and she was swinging a pailback, and she just felt a pop, chasing her 3 kids, and she didn't have anywhere to go, but she came to us when we came there, and so UofL is really special to her, and she's really special to me now. And we weren't able to reduce her shoulder, unfortunately, but I think the learning experience here is just like access to healthcare is so poor there, and we just try to combat that as best as we can. And yeah, so she is basically without a job now. Her children are suffering nutritionally, academically. Her livestock are declining because she can't pay for food. Yeah, just a lot of trickle effects going on within that country that we've been able to somewhat help and give them hope.
Many of you have heard about acupuncture, but do you know what it really does or how it really works? Well, Dr. Lizzie Doll is with the University of Louisville Child Neurology Department, and she's here now to talk about acupuncture. She's a real doctor, but she does acupuncture, right, Lizzie? Isn't that right?
So,
All right.
I grew up in Louisville and trained at UofL Medical School and completed my residency in child neurology at the University of Utah, and then came back home to practice.
All right, so you're going off to be a doctor that cures things with drugs and surgeries and those kinds of things, and you somehow get into acupuncture. How'd that happen?
Yeah, so I've always had an interest in integrative and complementary medicines, and that really stemmed from my experience studying in India when I was in my undergraduate years. And I spent about 8 weeks in southern India during that time studying Eastern medicine, and that really really inspired me to kind of explore how we can try to integrate Eastern and Western philosophies.
And so you come back to the United States, and did you have to get some specialized training in acupuncture or not?
Yes, so after I completed my medical training and I came back to Louisville, University of Louisville was really supportive in allowing me to go to Boston to Harvard to train for acupuncture. And I completed a 300-hour course at Harvard, so I was in Boston several weekends over a 9-month period, and also did a lot of coursework.
So Harvard teaches acupuncture, huh?
Yes.
That's kind of funny. All right, but you're a child neurologist by trade, right? So acupuncture and kids. I don't think most of us would even put those two in a sentence together, but it works, right?
Yeah, so believe it or not, acupuncture works really well, even in kids. And, you would think that kids would be scared about getting acupuncture, but they really do well and are anxious to come back for more.
We're talking with Lizzie Doll, who's a child neurologist at the University of Louisville. We're talking about acupuncture. So how many kids have you stuck needles into?
Well, I just opened my clinic in March of 2018, and I practice once a week at the East End Clinic out near Costco. And I also do inpatient consults for patients that come into the hospital, for example, that have severe migraines, and we do consults in the hospital to try to treat their headaches.
Yeah, but that was going to be my next question. When you're talking about children, what kinds of things can acupuncture be used on to try and cure or to relieve the pain?
I mean, acupuncture has been around for thousands of years in China, and so it really can be used for any kind of condition, but it really works well for pain. And so as a child neurologist, I see a lot of migraines and other headache-related conditions, and acupuncture works really well for them.
And little kids, are we talking 4-year-olds that you do this on, or what kind of age?
I typically say once they are about 8 or older is when acupuncture it works the best, and that fear factor is a little bit less.
Okay. When the doctor shows up with, how long are those needles that you use?
They're tiny. I mean, they're very small. They're, hair thin, and so.
But how long though? How long?
They're about this long.
2-3 inches long.
2 inches long, and
Okay.
2 or 3 inches long, and I typically demonstrate on myself just to show them that it doesn't hurt, and that they really don't feel the needles when they go in for the most part.
What did the parents of an 8 or a 9-year-old say when they come to perhaps you or to somebody else and say, "Hey, my kids have really bad migraines. We can't get it resolved," and you say, "Let's do acupuncture."
Yeah.
What do the parents normally say?
In the 21st century, we've really, I think, made a lot of headway in incorporating these ancient philosophies, and so. I find that parents really are enthusiastic about it, and it's a non-medication treatment to help treat migraines, and so typically they're all about it. So
they like it.
Yes.
So they're good with it. And then when I saw a picture that you had a child there that had needles in his forehead. You just kind of look at that, and as a parent, you're kind of going, well, that's not something I would have thought of with my kids. Do you get any parents that say, yeah, I'm okay with this, and then when they see the picture of their kid with the needles all stuck in their face, they're going, well, I don't know about that.
I haven't really gotten that response so much. I really have had pretty positive feedback from working with kids, and with acupuncture, you don't necessarily treat the head itself for a headache. You actually treat other areas of the body. So you might treat the feet or the hands or even the ear to treat a headache.
So how does acupuncture then work? How is it that you treat a headache by sticking a needle in my foot?
So the thought is that the body has a lot of energy channels, and with stress or illness, these channels get blocked, and so the purpose of acupuncture is to kind of clear up these channels and allow that flow of energy to move.
We're talking with Dr. Lizzie Doll, who's a child neurologist at the University of Louisville and also works at Norton Children's Hospital. And you can find her practice where? You got an East End clinic, right?
Yes, so I primarily practice downtown at the new Novak Center on Preston Street, but my acupuncture clinic is out Highway
42 or
22?
22. Out by Costco?
Yes.
It's out by
and,
Highway 22, yeah.
And that's where I do acupuncture, and I also do the inpatient consults at Norton Children's Hospital as well.
Okay. And when we're talking about medicine, do you consider acupuncture medicine?
I do. I think that, acupuncture, biofeedback, meditation, things like these really have a place in our Western society, and the human body has a pretty strong ability to heal itself, and that's why I'm a big proponent of acupuncture and these other integrative practices.
From your perspective, should acupuncture be a last resort for parents who can't figure out how to relieve the pain with their kids, or should it be something that they should think of first, perhaps?
Yeah, I mean, I typically will start with medication treatment, but if the patient or the family wants to avoid doing that, sometimes acupuncture alone can be effective. And, I think it can also be used in conjunction with medication treatment to make that medication even more efficacious. And I
Is it tough to tell them what they should do? I mean, when they come to you and they say, what should we do? You normally prescribe medicine first? Is that what you're essentially saying? And then perhaps you might say, well, you know what, nothing's worked on little Bobby here. Let's try acupuncture. Is that normally how it goes?
Yeah, I mean, the science is starting to catch up to this ancient practice, and so really, it can be used as a isolated treatment plan, and so if it works, then, and it's not a medication, it's not something you have to take on a daily basis, then why not try it? And it doesn't really have any side effects, so I'm
That's one of the options for parents and kids, right? Okay.
for sure.
Her name is Dr. Lizzie Doll. It's Elizabeth Doll, Doll, if you want to find her in the phone book. She works at Norton Children's Hospital and also with the University of Louisville Physicians. You can find her in the phone book or online, right?
Yes.
Okay, very good.
Thanks so much.
Is there a link between the Zika virus and schizophrenia? Well, two UofL researchers have taken a look at that. El-Mallakh is a professor of psychiatry, while Yeruva works in infectious diseases. Welcome, gentlemen.
Thank you for having us.
Riff, welcome back to the show. Good to see you again.
It's good to be back.
All right. Well, let's talk a little bit about Zika. Let's start there. What is Zika, and where is Zika, or is it anywhere in the world still?
Yeah, Zika is very interesting. So Zika is just a virus that's actually was originally discovered in the 1940s when they were actually looking for yellow fever virus, and it's called Zika because it was originally identified in the Zika forest in Uganda, and that's so it's actually endemic, meaning that's where it normally lives in Africa and Southeast Asia. So that's where it normally exists, and in that population, it's maintained in wild animals and transferred from animal to animal with a genus of mosquitoes called Aedes mosquitoes. And several Aedes mosquitoes can transmit it. But where it's endemic, humans will get it. They might get a mild illness, fever, arthralgias. They don't feel very good for a while, and then they just get better. They develop an immunity to it, and it's fine. But recently, in this millennium, it's sort of jumped across the ocean. So it initially jumped actually across the Pacific or into the Pacific and then into the New World.
Yeah, those mosquitoes flew a long way, didn't they?
Well, it's
that was
quite
a joke,
impressive.
by the way.
Just as an aside, by the way,
yeah.
the top speed of a flying insect determines the wind speed that they can tolerate. Mosquitoes fly at 2 miles an hour, so they literally cannot fly when the wind is more than 2 miles an hour.
All right.
And then it's interesting to see that how the disease started in Africa and then it spread over to Asia, and then there is an endemic in Micronesia in like 2007, and then 2013 the other part of Micronesia got affected. So now it's turned to Brazil in 2015, and due to the Olympics at the same time, it got,
That's right. I
there's
remember
like
that.
frequent travel of people from USA and to Brazil, and then it got to United States now.
All right. So Raj, you and Riff looked at how Zika affects the brain and specifically schizophrenia. So how does it? What'd you find?
So usually this flavivirus got its name from yellow fever, which when they are looking for, Zika is related to the flavivirus family, but only Zika can cross the blood-brain barrier. But the other virus like yellow fever virus and West Nile fever virus doesn't cross the blood-brain barrier due to the...
I'm sorry, it doesn't cross a what virus? I couldn't understand you.
Blood-brain barrier, which is the...
So there's, we have a barrier in our brain that keeps bad things out. The brain is sort of protected inside the blood-brain barrier.
Yeah, I didn't know what that was.
It's
the BBB.
BBB.
Yeah,
and it really protects us from lots of things, mainly chemicals, but it can also protect us from some infections.
But Zika can cross that. Is that what you said? Zika can cross that barrier,
and
so
it
it's not...
it can also cross the fetal-placental barrier, which actually protects the baby from the infections, all kind of toxins from the mother, during the pregnancy.
Right, because a few years ago when we were hearing about this outbreak in Africa, we were hearing about these babies being born, that were malformed and had some other
in Brazil,
disabilities.
not in Africa. So in Africa, it's endemic. So where it's endemic, most people have natural immunity, and so the babies are protected because by the time their mother becomes pregnant, she's already gotten the infection when she was younger. But where you have a large naive population, now all of the sudden, lots of people are getting infected. A lot of adults are getting infected. A lot of pregnant women are getting infected. And like Raj was saying, because the virus can cross into the where the baby is, cross the placenta. It can, and because it is, the word we use is neurotropic, it gets into the brain and can affect brain development, you end up with a lot of potential for abnormal brain development. So the most severe of that is what we call anencephaly, which literally means no head. Now they have a face, but they don't have a head. They don't have a brain. So you have a face, and then sort of it's really horrible.
Yeah, that sounds really horrible.
And children, of course, don't survive for very long after they're born. They can be born, but they usually don't survive for very long. That's the most severe manifestation.
And I want to correct myself. It's actually Zika crossing the fetal-placental barrier, not the blood. I said that flavivirus, like West Nile fever, doesn't cross the blood-brain barrier, but actually they cross the blood-brain barrier. I'm saying it's fetal-placental barrier, which the Zika can cross and, causing the
problems. I got you. Okay. Again, we're talking with Ruch El-Mallakh, who's a professor of psychiatry, and Raj Yeruva, who works in infectious diseases at the University of Louisville. They worked on a study linking Zika and schizophrenia and other brain problems. So how did it get to the point or how did you figure out that there is or is not some link between Zika and schizophrenia?
Well, we haven't.
Okay.
So what we're proposing is actually an opportunity to test a fairly important hypothesis which has been around for a long time, which is that some neurotropic infections, again, infectious agents that are able to get into the brain particularly into a developing brain, that some neurotropic infections can cause abnormalities in the fetus that then result in schizophrenia in that individual when they're an adult.
And it manifests itself later on.
Right. So this is actually a hypothesis that has a fair amount of support. But it's impossible to test that in humans because you need a prospective study. Now we have the perfect opportunity to do a prospective study. We have a neurotropic virus that will naturally infect a lot of pregnant women, even if they take precautions, and has already infected a lot of pregnant women. And we know some of these kids have developed other brain abnormalities that if they don't have the most severe manifestation, anencephaly, they've developed other brain abnormalities. So the question is, if we follow these kids into young adulthood, do they have an increased risk for developing schizophrenia? And so this is really a very unique opportunity to test a very important hypothesis that has a fair amount of support, but you can't test it directly. You can now test it because of Zika. And so the paper was saying, we have the opportunity, let's do it.
So, Raj, what are you going to have to do? Go down to Brazil and find all these kids that have been born to mothers who have the Zika virus?
Yeah, so what I could say, it's really hard to approach all those because CDC recently, they started a organization called ArboNet. They are actually collecting all the cases who are infected with confirmed diagnosis by testing the genetic material of the virus in the patient. So they have the registry where they have a history of all the patients, and they're trying to find a new vaccination. Maybe in the future, it might prevent this happen, but I don't know if there is anything that we can do to the people, like the people who are already affected with the virus.
Well, one thing I want to, as we get ready to wrap up here, one thing I want to ask you is that we haven't heard much about the Zika virus in the news this summer. Does that mean the Zika virus is going downhill? Does that mean we're doing a better job of preventing it? Or is it ready to raise its ugly head in the United States tomorrow?
Yeah, as you said, recent numbers in Zika, the incidence of Zika has been really down. As of in 2015, there were like 1,200 cases initially, and 2016 there was like 40,000 cases in United States and their territories. In 2017, it got down to like 1,400 again. This year, until now, we just have 140 cases registered in ArboNet. So
it's very good, and again, this virus, the virus may transmit itself into the fetus of humans, but it cannot cross from mother mosquito to egg mosquito. Some infections can, but Zika can't. And so for Zika to maintain itself in the population, it has to have infected individuals that it gets the virus from and transmits that virus to another individual. And since there aren't natural creatures here, there are no monkeys here, which is the natural host in Asia and Africa, the only sort of natural population would be humans.
Right. All right. Well, that's pretty interesting stuff. So hopefully folks will say, yeah, that's a great study you guys really want to do. Why don't you go ahead and do it and give you a bunch of money to go do it, right, Riff?
I hope so.
What you're hoping for?
I hope so.
All right. Riff El-Mallakh, always good to see you. Raj Yeruva, appreciate you being on the show.
Thanks very much.
All right, that'll about do it for this edition of UofL Today with Mark Hebert, which you can hear every Monday and Tuesday night at 6 on 93.9 The Ville. You can also listen to the podcast of the shows on SoundCloud or watch the programs on Metro TV, which is Louisville's government access channel, or KETKY throughout the week. Check out all the UofL news, videos, and events at UofLnews.com. Thanks for listening to UofL Today with Mark Hebert, and go Cards.
Go Cards.